Good morning, friends. Today we will discuss the remaining pictures and images from the Australian Medical Council handbook. So, our first picture is you can see the swelling here on the left side of the neck. So, this swelling is metastatic thyroid cancer in the lymph nodes. We have to take the biopsy to confirm the diagnosis. Our next picture, here you can see the picture of tongue. This is the right hypoglossal nerve palsy. This tongue is deviated on the same side of the lesion. So the central lesion, the side of the lesion when outside mouth. This often caused by the carotid endarterectomy. Tongue will deviate to the same side of the lesion. So here, this is the right hypoglossal nerve palsy. Our next picture is the cupping of optic disc. Here you can see the image. This open angle glaucoma, optic cup to optic disc ratio increased, and there are two types: open angle and close angle glaucoma. The open angle, which is called chronic glaucoma. In open, which is gradually onset, and close angle, which is acute. So in close angle, there will be a VL loss, headache, severe eye pain, light halos, and red eye, corneal cloudiness, poorly reactive to poorly reactive mid-dilated pupil. Diagnosis by the gonioscopy. So this is the cupping of optic disc. In close angle, the symptoms will be acute, and but as compared to close open, because angle is already open, so the symptoms will be gradual. And open angle can be diagnosed by the tonometry. As for the chronic angle glaucoma, for the close angle glaucoma, we diagnosed by gonioscopy. Close angle is very commonly comes in the exam. So they give standard treatment is iridotomy for close angle, and for open angle trabeculectomy is the gold standard. This is the another picture. You can see the left sixth nerve palsy. Here you can see the right eye turns inward. So this is this left sixth nerve cranial palsy, which is the abducens nerve, and this involving the which supply the lateral rectus muscle. So um, because of this palsy, the lateral rectus muscle, you can see the right eye is turned inward. Our next picture, the Bell's palsy. This is very commonly comes in the exam. So you have to go through this topic. Here you can see the right eye is closed and deviated angle of the mouth. And also here this patient can present with the vesicles around the ear or over the ear, so that we call Ramsay Hunt syndrome. For the treatment, we go with the steroids, but if it is severe, then acyclovir can be given. So this is the case of the Bell's palsy, seventh cranial nerve. Here you can see the another picture of posterior intraosseous nerve. Uh, this is the branch of radial nerve. So because of this nerve palsy, patient is unable to extend the left fingers and thumb. So here you can see the patient is unable to extend the fingers and thumb, but not the entire hand. So if it involves the hand, like complete hand is dropped down, if he's unable to extend, then we have to think about the radial nerve palsy, because radial nerve will be involved, but here it's a posterior intraosseous nerve, which is the branch of the radial nerve. So only patient is unable to extend the fingers and thumb, but not the wrist. So you have to keep in your mind that here the posterior intraosseous nerve is involved. Very important picture. Once you will see 2 3 times, then you will be able to remember, then you will be able to differentiate in the exam that what the examiner is asking, either about the radial nerve or the branch of radial nerve. So here trauma to the posterior forearm, branch of radial nerve is involved, posterior intraosseous nerve. Keep in mind, this is very important. This is the ulnar palsy, elbow injury. After elbow injury, uh, ulnar palsy or ulnar killer hand. Just look at the picture. We will do the MCQs as well from the AMC handbook. Here it is ulnar palsy, ulnar killer hand after the elbow injury. So another picture, here picture is not very clear, but if I would zoom it, this is the case of cerebral tumor. I want to highlight it. Here you can see the circle, homogeneous opaque. Here you can see this, which I have encircled it with the red line, and this is the cerebral tumor. Actually, picture is not very clear, but if you will go through the handbook of AMC, you will see the picture is clear there. This is the picture of left clavicle fracture. You can see very visible bulging on the left side of the, this is left clavicle. Fracture of left clavicle. Here you can see in the X-ray appearance. You can see this clavicle fracture. This is this surgical neck of humerus, fracture surgical neck of humerus. So whenever the surgical neck of humerus occur, the axillary nerve involved, so patient would not be able to abduct, and also there will be a decreased sensation. So axillary nerve, which supply the deltoid muscle, so patient would not be able to abduct the shoulder. So here you can see the X-ray image of this picture of surgical neck of humerus. This is the posterior dislocation, traumatic dislocation of left hip. Here you can see the shortening of the leg. This is very clear. Uh, Here you can see the both legs. One leg is shortened. So this is the dislocation of the left hip. Shortened and internal rotation of the sciatic nerve. This is posterior dislocation of left hip. So another picture of dislocated acromioclavicular joint. Here you can see the acromioclavicular joint. This is a case of cervical spondylosis, chronic degenerative disease of aging. This is the Colles fracture. Here you can see the picture of the dermatomyositis of the hands. Proximal weakness, creatine kinase will be on higher side, will be raised, and heliotrope, anti-Jo, anti-MI, these things we have to check. For the diagnostic investigation, electromyography, nerve conduction velocity, and then we have to rule out the malignancy in adults. So this is the case of dermatomyositis. Thank you very much.